Stress, anxiety, burnout. We feel it in our gut before we feel it anywhere else. Today we find out why. This is The Gut Truth. And we're joined by the amazing Dr. Rabia. Let's dive in. What started your relationship with gut health and how has that continued to shape your work?
In my first year as a junior doctor, I got allocated to the gastroenterology ward, and I figured out really early on that we cover so many organs, and the gut is connected to the liver, the pancreas, and the gallbladder. And so these four areas interconnected have formed and shaped my understanding of how to manage gut health over the years.
And you have like so many strings to your bow, like consultant gastro, yoga teacher, CBT, so like I guess that has come from having all your experience throughout the years and realizing that gut health is multifactorial.
Exactly. I think the multiple factors that feed into gut health make me understand the gut is not an isolated organ, but it exists in a system. And approaching that system from different angles is how you take yourself on a path to managing your symptoms in a better way.
Obviously in clinic, you're a consultant gastro. Mm-hmm. What is the most common thing that you're seeing in clinic today?
Okay. So as a kind of medical gastroenterologist, the most common thing I see by far is the diagnosis or the symptoms of irritable bowel syndrome. So IBS or irritable bowel is a condition of the gut-brain interaction. It affects about 1 in 20 people worldwide, but in the UK, probably about 1 in 10, more often women than men. And the symptoms are really defined by discomfort or pain in your belly associated with a change in your bowel habit to going more often than usual. So a diarrhea or looser stool, or going less often than usual. So a more hard or constipated stool. And if you're having a change in your bowel habit with pain, probably more than a couple of times a week over a period of 3 to 6 months, and you've had tests that have excluded a problem with the structure of your gut, you're left with possibly a diagnosis of irritable bowel. And that's the most common thing I see in clinic.
Why do you think we have such a high prevalence of it in the UK? Because you said 1 in 20 worldwide, but 1 in 10 in the UK.
Yeah.
Have you sort of managed to pinpoint why that could be?
I think one of the key factors is the Western modern lifestyle that we live. And the factors contributing to that are probably twofold. One is diet. So the prevalence of ultra-processed food, which is food that is really processed in high in sugar and salt and fats. And the other aspect is probably our environment. So levels of pollution, levels of from the water that we drink to the quality of our sleep, and particularly the levels of chronic stress in Western society.
And you've been in the gut health game for a long time. Have you seen a rise in gut issues, or do you think the rise in knowledge of it means that more people are coming for a diagnosis, or is it a mixture of both?
A mixture of both. So I think that we are talking about it much more. Stigma is being reduced, especially by interactions like we have. Based on the modern lifestyles that we lead, the ultra-processed food industry is having a huge wave of impact on the ecosystem of our bacteria in our gut, the so-called microbiome. And those shifts are really meaning that the prevalence of irritable bowel is on the increase, as well as inflammatory bowel disease and unfortunately bowel cancer as well.
In IBS, the symptoms could be, bloating, pain. So how, you said earlier that it's linked to, it's a gut-brain disorder. How is that when we sort of see them as so separate?
Yeah, so I think for a long time we've understood, again, that the gut is not existing in isolation. And since birth, there's been a bidirectional, so two-way conversation between the gut and the brain via the nervous system. And so where the gut has signals such as telling you when you need to go to the loo or when you need to pass wind, those signals are rapidly communicated like electricity along a phone line from the gut up to the brain. And then the brain integrates those sensations with our environment. So is it safe to pass wind in front of Alana during an interview?
Go for it.
Yes. Therefore, the brain will send a signal right back to my gut to relax my anal sphincter and let the gas loose. And that's the most simplistic way to understand that there has to be a communication between our nervous system and our digestion in order for it to be integrated with the world around us and the fact that we have control.
Why do you think gut health is emotional as well as physical?
I think intuitively we believe that emotions live in the mind, and the reality is that they live in the body. Something like fear or anger. When we have a feeling of fear, our heart rate goes up, our blood pressure increases, we have a really low grade sensation of sweating. These are part of the body's release of adrenaline and cortisol, which are hormones that are shifting our nervous system into fight-flight mode. Our body is literally gearing up to deal with a perceived threat when we feel fear. In doing so, our gut is also communicated with, because the gut and digestion sits on the flip side of our fight-flight mode. And so it's virtually really challenging for our body to rest and digest when our body is gearing up to manage this emotion.
So how do you try and break those cycles from someone that maybe is spiraling with a gut issue? How do we sort of intervene and break those circles?
When you're spiraling from a gut health issue, it's really challenging. I think the most important thing is to take a step back and be empowered with education. So the first thing I do in clinic is I talk to people about what their gut is actually doing to make their gut for them rather than against them. And in doing so, I hope to empower people with the kind of tools to manage their gut health issues, so people can leave feeling a bit more in control about the lifestyle factors that they can change to influence their gut health. And so I think what stops the spiral is understanding your body more and also feeling empowered with tools to manage your symptoms.
Right, shall we get into a game?
Let's do it.
Pick up those paddles. Right, first one, you ready?
Mm-hmm.
You need to heal your gut.
Bullshit. You don't need to do anything to your gut. I think that your gut is on a natural path to self-regulating itself. Somewhere along the line, if you have symptoms, you've gone off course, and gently, compassionately nudging yourself back towards the right path, your gut will heal itself. You don't need to do anything or take anything or even behave in a certain way.
All probiotics are the same.
No. Definitely
Straight
not.
answer, no.
So probiotics are live bacteria intended to have a benefit in the gut, and they form part of the rich ecosystem of the bowel. But probiotics are made of individual strands of bacteria, each of which has a different research-backed evidence base for what it helps and what it hinders. And so my top tip is that when you go and choose a probiotic, if you have general gut issues, a multi-strain makes sense. But if you have a specific gut issue, have a look at the strain and the amount and do a little bit of research to understand why that strain would be good for you. But yeah, definitely not one thing.
Put the work in to get the one that's right for you.
Definitely.
Right, a food intolerance test will tell you what's wrong.
No.
Couldn't pick up that paddle quick enough.
This is one of the big bugbears I have. So let's just take a sweet deep dive into that. So food intolerance tests are commercial. They exist online and in the pharmacy. And they are most commonly a blood test for something called IgG. Now, IgG is part of your immune system, and we all produce an immunoglobulin or a protein molecule called IgG in response to the food that we eat. And what a food intolerance test does is it measures the IgG in a blood test. So you do a pinprick and you send that off to the lab in the post, and it looks at the IgG response to that food. Studies have shown that, unfortunately, it's not reliable. And actually, what it's looking for is more your tolerance of food than your intolerance. And we all, as a healthy adult, produce IgG when we eat more of that food product. So what we know is that if we did that same test on a different day, we would get a different result in the same person. It's not reliable.
Your gut resets overnight while you sleep.
Okay, so that's true.
Good, we have one that's true.
Yes. So the gut, as I said, so fascinating. It works on a body clock, much like we do. So we have a circadian rhythm, which means that we are awake during the day and asleep when it's dark. And our gut also works on a clock. So when we sleep, our saliva production reduces by 50%. We don't really swallow very much. Our stomach emptying slows. Our colonic bowel movements also slow, which is why it's not normal to wake in the middle of the night to open your bowels. Most people don't.
Oh, yeah, no. I mean, you pee, but you wouldn't poo
You pee,
necessarily. Yeah.
but you don't poo.
Oh.
And if you did poo, it would be abnormal and actually is what we call as doctors a red flag. So if you are waking in the night to open your bowels, it's a big red flag and you should see your doctor because you could have a problem with the structure of your gut. So all of these things happen and at night so that the gut can start to go into restorative mode. And it's like a washing machine on a cycle where you're not putting any clothes in. So
a rinse.
It's a rinse cycle on a washing machine. That's what's happening at night because the gut's just resetting itself. And so, yeah, it does actually rest when we rest.
Okay, we're on to game 2. So this is snack, marry, avoid. Cutting out gluten forever. I think I might know the answer on that one. Never eating onions or garlic again, or a strict low FODMAP diet for life.
I have to snack, marry, avoid one of them.
Yes.
Right, okay.
Yeah.
Oh, just one of them. Just one of them.
Yeah.
I mean, I would avoid all of it.
Yes. Okay.
Am I allowed to?
We'll allow you one pass where you can avoid all of it.
Yeah, all of that. No. I mean...
So low FODMAP, can you explain a bit about what that is, why it's used in IBS, and why we shouldn't be on it forever?
Yeah, because what's interesting is the low FODMAP is avoiding onion and garlic and wheat. Yeah. So it crosses all three.
Yeah.
So the low FODMAP diet. So FODMAP is an acronym that stands for fermentable carbs. And essentially, it's carbohydrates that are poorly digested in your small intestine and lead to either excess gas or gas trapping in the bowel. And that leads to uncomfortable sensations like bloating, but also looser stool. And it's a very good evidence-based diet for irritable bowel syndrome. And what happens is you are used to see a dietitian and you have a long list of foods that you need to cut from your diet for a fixed period of time, and then you reintroduce each fermentable carb one by one to see what your tolerance levels are and which ones you should avoid in the long term. And then you hopefully end up with a list of like 3 or 4 foods rather than 50 foods that you have to avoid. Unfortunately, some people who follow a strict FODMAP feel so much better avoiding 50 foods that they end up avoiding them in the long term.
Forever.
That can lead to nutritional problems, but also a really disordered relationship with food, where we have fear around food eating and food avoidance. And unfortunately, that's the long-term problem why I would avoid it. So it's the same with cutting out gluten and onions and garlic. I think it's definitely worth a trial if you have IBS to cut them out for 6 weeks and then start to reintroduce them slowly, but not long-term.
Okay, we're avoiding them all. Breaking the rules. Right, the gut feeling. Eating only when hungry, never by the clock. Meditating before every single meal. And journaling your food feelings daily.
Okay. Okay, so I would I'd marry journaling.
Yes.
I think. It's such a positive self-reflection exercise that allows you to enhance your understanding of your mind and body. And so if there was one ritual I would stand by, it would be journaling.
Do you have to write it down like old school, or could you type it in your phone?
Not only could you type it, but you could audio. Like,
oh, right.
I mean,
so the muscle, like the science is behind just literally saying it, writing it out loud.
Yeah,
right,
I think
cool.
So. It's literally processing, isn't
yes.
it?
Yeah, I suppose your mind's working through it as you're saying it or writing it.
For sure.
Okay.
Exactly. So yeah, I'll probably marry that one.
Yep.
I would snack on the meditation. Before, but I mean, I can't meditate before every meal, and I
was going to say it's quite unrealistic.
Yeah, I think for habit change, we need to be moderate in our asks of ourselves.
Yeah.
So,
I have went a bit extreme on these. So.
Yeah,
just for entertainment purposes.
For sure. Meditation is a useful tool to down-regulate your fight-flight response. And so when you meditate, you shift your brain waves more into delta mode, which allows your nervous system to relax and move into a space where you will digest in a calmer way. And so it is a great habit to take a few deep breaths and close your eyes and give gratitude for the meal you're about to eat. And if you can do that in 10 to 15 seconds, that I think would be sufficient as your meditative ritual.
Cool.
And the last one was
eating only when hungry.
Yes. So this is an interesting one because I am a huge advocate for listening to your body's signals and responding to hunger cues. But what I do find interesting, Alana, is that everybody has different appetite fluctuations. And there are some people I meet in clinic who tell me that they rarely feel hungry. And so if they only follow that, they would rarely eat. So I think one should listen to our hunger cues and by contrast, our satiety cues when we feel full.
Yeah.
So we should listen when we feel full and listen when we feel hungry. But if you're not someone who feels either very acutely, it could be a genetic component. And I would still have regular meals.
Okay, the clinic classics, this one is called. Antacids with every meal, peppermint tea for stomach ache, and activated charcoal cleanses monthly.
Okay, let's just start there. The charcoal thing, surely it's some logic around charcoal being an absorptive substance.
I used to do it when I had a hangover.
Oh, yes,
I don't,
exactly.
Yeah, I don't know.
So it's hangover material. It's also in toothpaste to cleanse your teeth.
Oh, yes.
Whitening.
And I
toothpaste.
think if you've got like food poisoning, they say to have charcoal.
Right. So it's this absorbent where it will absorb like tartar on the teeth and alcohol in the belly and bugs when you've had a nasty food poisoning. So it's this idea of absorbent. But I'm going to speak to the idea that you have to take something to detox the body. Guess what? The body detoxes itself. The liver and the kidneys do a better job than charcoal ever will.
Okay. So we're avoiding charcoal, peppermint tea or antacids for marrying.
I would have to marry peppermint tea.
I know you love peppermint tea.
I do.
You have got me on peppermint tea every night.
Right.
Peppermint tea.
And I think that, my patients in clinic, they come to me to talk about natural solutions to overuse of medication. And we'll come on to this, I'm sure, a bit later. But, things like proton pump inhibitors, PPIs such as omeprazole and Gaviscon and Renes all have a really important role, particularly if you have peptic ulcers and that's driving your abdominal pain. So in no way am I suggesting that medication shouldn't be used for certain types of pain. But if you've been diagnosed with tummy cramps due to your IBS, and you end up on these medications, they can have long-term impact on your gut microbiome. And I think we're understanding more and more about that. Peppermint, by contrast, is a natural leaf which has evidence-based proven anti-spasm properties.
When you told me this, that it was evidence-based, that you would recommend it in clinic, I was like, no way.
Right. The studies that have looked at peppermint have to be dose-related in order to come with a conclusion. And so the capsule is useful because it's a defined dose. If you get some peppermint leaves and dunk them into tea or a tea bag, it's really hard to tell how much of that peppermint is going to infuse into your water. But a capsule is traditionally 200 milligrams.
You just knock it back.
And you knock it back with a sip of water before the meal, about 10 minutes before the meal. And 3 times a day if you need to. And it's particularly good for discomfort and pain after eating. So if you are someone who eats a meal and will get pain or discomfort after eating within the first 15 minutes, we call that dyspepsia. So pain, discomfort or bloating after eating, maybe with some nausea. Peppermint is been shown with caraway to be a really good
the caraway seed.
Caraway seeds, yeah.
All right.
Yeah.
So we're going to snack antacids because they have their place.
They have their
we
place.
don't just take them for the sake of it.
Exactly. And I think there's an overuse of them at the moment that is proving to have consequences based on pH changes in the stomach.
Right, last one. This is the internet made me do it round. Drinking your own celery juice every morning. A coffee enema weekly. Or fasting for 48 hours monthly.
If I had to marry one, I'd guess it would be the fast.
Yeah.
I think fasting for 40 hours every month, if you're not fasting any other time, is an extreme behavior change because fasting has huge effects on our blood sugar levels and our hormones, especially as women. So if I can, I would marry the fast, but I would change
with
it
a caveat.
with a caveat.
With a prenup.
With a prenup. I like it. Exactly. And the prenup would be the intermittent fasting. So restricting your time feed window would be the thing I would look into if you're into fasting. And I think that would work really well. And then the coffee enemas, I'm going to, if I have to, would be to snack on that. And I think it's the idea that coffee, the caffeine absorbs through your rectum and can somehow influence your bile acids. There's no evidence for coffee enemas. But the use of enemas to help with constipation is something that's been going on since the beginning of time.
All right.
And so often I will prescribe enemas for constipation, not coffee enemas. It's usually a phosphate enema. There's something to be said for the fact that when you struggle with constipation and you're struggling to empty, the accessing from bottom up is actually a very effective way to empty the gut and have a bit of a clear out. And so enemas are really good if you've got long-standing constipation.
I didn't realize they were still used in clinic.
Yes. Yeah, very much so. And also, before you prep for an endoscopy.
Yeah.
So I would do that. And then
celery juice.
Man, where did this come from? I don't think I paid it much attention.
Man.
Yeah. It's just some of those things that you think
nonsense.
I wish people didn't spend so much of their mental energy on. I mean, celery is 95% water. And the rest of it is fiber. So if you juice your celery, you're essentially getting a hydrated glass of water with a few minerals like vitamin C and K. And so I think it makes you feel good because you're drinking a glass of water, hydrating. And I think that's probably why people would feel good. I think the rhetoric was have a glass of juiced celery first thing in the morning. Well, if you just have a glass of water, you'll be fine.
Yeah.
And then you won't need to waste so much celery pulp, which is actually really high fiber and is definitely the song we want to sing.
Okay.
The fiber song. Yeah.
Next, we're going to build a gut day. Okay, Dr. Rabia's gut day. If you had to build the ideal gut supporting day for the average person, what would it look like and where do most people's days go wrong? So if you think morning routine, first meal, movement, stress management, evening meal, and one non-negotiable. So if we walk through a day of what a gut-friendly day would look like.
So you start your day with a glass of celery juice. Okay. You wake in the morning.
Yeah.
And I'm allowed to do exclusions, right?
Yes,
okay.
Totally.
So eyes open, avoid doom scrolling. So the first thing that people often do is look at their phone. Maybe they're checking the news or their WhatsApp. It really puts the body into a fight flight mode from the first few seconds of waking. So you've gone from a nice, hopefully deep sleep into fight flight mode. And that switch is way too harsh. So first thing in the morning, wake up, stretch. You've been in one position all night.
I've heard that you should do, what's it? High, low, side, side.
Oh, nice.
Seemingly.
Simple.
Up, side, low, side, side.
Simple. I mean, if your partner's there, then or a dog
or a child.
Yeah. You maybe want to get out of bed first. But yes, I would say if you can, first thing you wake up, you stand outside, stretch. Open the curtain or, in fact, the window and get direct sunlight onto your retinas.
In your eyeballs.
Yes, in your eyeballs to your retinas. There is very good evidence that direct sunlight in the first 30 minutes of the day will set your circadian rhythm for the following night. And we've already talked about how your gut restores during sleep.
Right. I didn't realize it was for the following night.
Yes.
Right. Okay. Got you.
Drink a full glass of water because you dehydrate overnight. So first thing, full glass of water before caffeine touches your lips.
Yeah, that's the mistake I make.
All of those things actually do improve gut health on different ways, but it's subtle. Yeah. By the time I'm getting to breakfast, I'm usually getting out, I would say, like a bowl of overnight oats. So I think if you mix your oats in the morning, they are more poorly digestible. And that's true. So if you soak them the night before, it's better. So get out your bowl of morning oats mixed with your fibers or, your flaxseed or kiwi fruit and top it with whatever fruit that you want. I do think sometimes people feel really hungry after a bowl of oats. So I would add yogurt, like a prebiotic yogurt to that. So that bowl or a high protein breakfast. And then as you start your day, obviously you're probably going into like a work day or it's on a weekend. And I think the most important thing for that first half of the day is to take regular pauses away from screen time.
Okay.
So people often just get glued into tunnel vision around their screens. And that again keeps them in fight flight mode. So I would say regular breaks. Set an alarm on your phone. You know, people often say that an alarm every hour for a few seconds will mean that you can get up and just stretch and move around. Then we get to lunch, I guess. And again, you need to do something that's easy around food prep. Food prep for me is one of the biggest tips I give to people for improving their gut health. So if you want to have, you know, a grain bowl or, I don't know, like even maybe last night's dinner leftovers, the most important thing is it's prepped. You know, you're not going to be able to eat healthy and not reach for processed food if you haven't done a bit of thinking before.
Yeah.
So whatever you choose for lunch, make it balanced, make it full of, you know, whole grains, oily fish, fresh vegetables, but prep before.
Okay, so we're sort of done the afternoon, evening meal.
So obviously I sometimes use my evening meals to like prep my lunch for the next day because I
so
just
do
double
half and half,
batch.
yeah.
So I do cook in the evenings, and I think again cooking is a rhythm and a routine that allows you to really communicate with your food and integrate it. So if you can cook fresh, that's great, and if you can't, if you've prepped, that's fine. But I think again the meal is leaning towards the more Mediterranean palate. Anti-inflammatory foods, which have been proven. So a portion of oily fish or lean protein, such as chicken or turkey, alongside fresh vegetables that have been cooked, you know, thoroughly, or raw salads, if that suits you, and then a portion of carbohydrates. I'm not somebody who thinks the carbs should be a lower portion of the food. I think healthy fats like olive oil and avocado are essential to that balanced meal. And, you know, following it with a sweet treat is perfectly okay. I'm 80-20 when it comes to diet. So 80% of the time, be really mindful, and 20% of the time, treat yourself to those foods that make you feel good. And don't beat yourself up about it. The guilt around eating, you know, processed food is far worse than the processed food itself.
Okay, good to know. Right, one non-negotiable in your day that you do for your gut health every day.
I would say my non-negotiable is the fiber I have with my morning breakfast. So for me, it's a tablespoon of milled flaxseed.
And can we touch on fiber with IBS? Because I think a lot of people that have IBS are like, I can't touch fiber. Like, is that true? And what can people do in order to get more fiber in the diet? Because I'm assuming even if you've got IBS, the recommendation is still to get 30 grams of fiber.
Indeed. So the recommendation hasn't changed, but fiber is a double-edged sword in IBS because sometimes it can increase bloating and discomfort in your belly. And so it's really challenging to know which types of fiber would be good. I think the simplest thing is if you have irritable bowel, things like the flaxseed and kiwi fruit are probably the kind of go-to fibers that I would say that are completely safe in IBS. And well-cooked vegetables that are low FODMAP. It's not a quick fix, but over time, your gut will thank you.
Amazing. Thank you, thank you, thank you. Thank you, thank you, thank you. Right, last one. This is the internet made me do it round. Drinking your own celery juice every morning. A coffee enema weekly, or fasting for 48 hours monthly.
If I had to marry one, I'd guess it would be the fast.
Yeah.
I think fasting for 40 hours every month, if you're not fasting any other time, is an extreme behavior change because fasting has huge effects on our blood sugar levels and our hormones, especially as women. So if I can, I would marry the fast, but I would change
with
it.
a caveat.
With a caveat.
With a prenup.
With a prenup. I like it. Exactly. And the prenup would be the intermittent fasting. So restricting your time feed window would be the thing I would look into if you're into fasting. And I think that would work really well. And then the coffee enemas I'm going to, if I have to, would be to snack on that. And I think it's the idea that coffee, the caffeine absorbs through your rectum and can somehow influence your bile acids. There's no evidence for coffee enemas. But the use of enemas to help with constipation is something that's been going on since the beginning of time.
All right.
And so often I will prescribe enemas for
All right.
constipation, not coffee enemas. It's usually a phosphate enema. There's something to be said for the fact that when you struggle with constipation and you're struggling to empty, the accessing from bottom up is actually a very effective way to empty the gut and have a bit of a clear out. And so enemas are really good if you've got long-standing constipation.
I didn't realize they were still used in clinic.
Yes, yeah, very much so. And also, before you prep for an endoscopy.
Yeah.
So I would do that. And then
celery juice.
Man, where did this come from? I don't think I paid it much attention.
Man.
Yeah. It's just some of those things that you think
Nonsense.
I wish people didn't spend so much of their mental energy on. I mean, celery is 95% water, and the rest of it is fiber. So if you juice your celery, you're essentially getting a hydrated glass of water with a few minerals like vitamin C and K, and so I think it makes you feel good because you're drinking a glass of water, hydrating, and I think that's probably why people would feel good. I think the rhetoric was have a glass of juiced celery first thing in the morning. Well, if you just have a glass of water, you'll be fine.
Yeah.
And then you won't need to waste so much celery pulp, which is actually really high fiber and is definitely the song we want to sing.
Okay. Snack and acids because they have their place.
They have their
we
place.
don't just take them for the sake of it.
Exactly. And I think there's an overuse of them at the moment that is proving to have consequences based on pH changes in the stomach. The studies that have looked at peppermint have to be dose related in order to come with a conclusion. And so the capsule is useful because it's a defined dose. If you get some peppermint leaves and dunk them into tea or a tea bag, it's really hard to tell how much of that peppermint is going to infuse into your water. But a capsule is traditionally 200 milligrams.
You just knock it back.
And you knock it back with a sip of water before the meal, about 10 minutes before the meal, and 3 times a day if you need to. And it's particularly good for discomfort and pain after eating. So if you are someone who eats a meal and will get pain or discomfort after eating within the first 15 minutes, we call that dyspepsia. So pain, discomfort, or bloating after eating, maybe with some nausea. Peppermint is been shown with caraway to be a really good
the caraway seed.
Caraway seeds, yeah.
All right.
Yeah.
Right, last one. This is the internet made me do it round. Drinking your own celery juice every morning. A coffee enema weekly. Or fasting for 48 hours monthly.
If I had to marry one, I'd guess it would be the fast.
Yeah.
I think fasting for 40 hours every month, if you're not fasting any other time, is an extreme behavior change because fasting has huge effects on our blood sugar levels and our hormones, especially as women. So if I can, I would marry the fast, but I would change
with
it.
a caveat.
With a caveat.
With a prenup.
With a prenup. I like it. Exactly. And the prenup would be the intermittent fasting. So restricting your time feed window would be the thing I would look into if you're into fasting. And I think that would work really well. And then the coffee enemas I'm going to, if I have to, would be to snack on that. And I think it's the idea that coffee, the caffeine absorbs through your rectum and can somehow influence your bile acids. There's no evidence for coffee enemas. But the use of enemas to help with constipation is something that's been going on since the beginning of time.
All right.
And so often I will prescribe enemas for constipation, not coffee enemas. It's usually a phosphate enema. There's something to be said for the fact that when you struggle with constipation and you're struggling to empty, the accessing from bottom up is actually a very effective way to empty the gut and have a bit of a clear out. And so enemas are really good if you've got long-standing constipation.
I didn't realize they were still used in clinic.
Yes, yeah, very much so. And also, before you prep for an endoscopy.
Yeah.
So I would do that. And then
celery juice.
Man, where did this come from? I don't think I paid it much attention.
Man.
Yeah. It's just some of those things that you think
Nonsense.
I wish people didn't spend so much of their mental energy on. I mean, celery is 95% water, and the rest of it is fiber. So if you juice your celery, you're essentially getting a hydrated glass of water with a few minerals like vitamin C and K. And so I think it makes you feel good because you're drinking a glass of water, hydrating. And I think that's probably why people would feel good. I think the rhetoric was have a glass of juiced celery first thing in the morning. Well, if you just have a glass of water, you'll be fine.
Yeah.
And then you won't need to waste so much celery pulp, which is actually really high fiber and is definitely the song we want to sing.
Okay.